Hi, Dr. Larry Altshuler here, coming at you again about healthcare and healthcare reform. Telling you things that you won't hear from the media and you certainly won't hear from the politicians. Now, in my last video, I talked about the importance of primary care and the fact that we're losing all our primary care doctors, and this is a real crisis that's already been recognized. And I told you the Republicans really don't even have reforms that address this problem. And the Affordable Care Act addresses it, but their reforms are not going to make a hill of beans difference in correcting the problem. In my last video, I talked about 3 efforts of the Affordable Care Act, all of which are going to fail. In this video, I want to talk again about the Affordable Care Act, because, and this doesn't have to do with provisions directly involved with primary care, but other provisions and other aspects that are going to really put the squeeze on primary care and force more doctors out of primary care. So what is that? Well, number one, remember I told you in previous videos that there's a huge effort here to decrease reimbursement to doctors across the board. The Sustained Growth Formula in Congress, the IPAB, the Independent Pay Advisory Board, President Obama's recent budget, all of them are going to be decreasing reimbursement to providers. The problem is that primary care already makes a little money with Medicare, that they're going to stop seeing a lot of these patients, but also they're going to get out of primary care because they can't make enough money to even make ends meet, a lot of them. So they're all going to go to specialties even more because of what the Affordable Care Act and administration is going to do. But there's another aspect of the Affordable Care Act. They have provisions that are really going to squeeze primary care and put more burden on primary care, and that's going to be a problem and make more primary care leave even more than they are now. Let me give you an example, the primary example. The Affordable Care Act has stated that all primary care physicians are going to have to use health information technology, computers. Within 2 years, all of them are going to have to, it's required, okay? Now, I think there's a good use for health information technology. I use a computer system, but I use one at the cancer center I work in, and it's a multi-million-dollar system, and it's beneficial to me. But most of these systems are not as beneficial as people think they are. That's number one. In fact, many of the studies done on health information technology have shown that it really doesn't do what it's supposed to do. It's not decreasing errors or prescription errors as it's supposed to do. So already we have some problems. But let me tell you what the Affordable Care Act does that's even worse. Now, they recognize that these systems are costly, and they are costly. So they're willing to give $64,000 to any family doctor or internist who wants to have a health information technology system. Well, that's fine and dandy. But experts will tell you that that's only 25% of the cost. So primary care doctors are going to have to come up with 3 times that amount of money out of their own pocket, and they already can't afford that. So that's one huge problem. Then once they have the system in place, they have to have technicians because a lot of them go into glitches. At my cancer center, we have full-time IT folks that can help the glitches and when there's problems. These family doctors and internists aren't going to have this. And in fact, studies have already shown that many states don't have any of these technicians that are qualified to do this. That's going to be a huge problem. But that's not the worst. The worst problem is what's called PQRI. You see, the government is saying, well, you need to have these health information technology systems, and once you get them, you're going to be required to send in 25 different measures to us every year on every patient. It's called PQRI, the Patient Quality Reporting Initiative, or what's also called meaningful use. Well, this is a real problem. Number one, these measures have been tried before and are the ones that have been found to not matter with outcomes. They don't improve healthcare outcomes. And yet the Affordable Care Act is using the same measures, which is crazy. But number two, to just do the reporting is going to take a great amount of time, overhead, and cost to do this. The cost is going to be extremely high. And it's also going to take doctors away from seeing their patients because they have to spend all the time to send these measures to the government. So this is a really, really bad idea, and it's really going to squeeze primary care worse, and it's going to give them another reason to try to become a specialist and get out of primary care, and that's going to hurt everybody. Now, the government in their wisdom has said, oh yeah, but you know, we think we will give you a 10% bonus if you do all this stuff. Well, that's all good as well. But I'm going to tell you that 10% is not very much, and it's not going to be enough to convince primary care to put up with all this government interference. But there's another key to this too, and this is so self-defeating. Because there's a string attached. The government says, oh, if you want that 10% bonus, 60% of your patients have to be Medicare or Medicaid. Now, I'm going to tell you right now that if 60% of your patients are Medicare, you're not making hardly any money. In fact, you may eventually be losing money. Again, because all that reimbursement is going to hit you and hit you hard. This is going to have the opposite effect. And we're going to end up having even fewer family doctors and internists around to treat you. That's going to be a problem because who's going to treat all the newly insured and all the baby boomers? Unfortunately, it's going to be a real problem, and neither the Democrats nor the Republicans are really doing anything to address this problem. So that's where we are, folks, and unfortunately, there's not much you can do, but you can go to my website, balancehealing.com, and at least there's information there that will tell you where you can go to get the most cost-effective treatment and find out what really works and what doesn't really work. So until then, thank you for watching this video, and I hope you'll come back and watch my other videos.